Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What are the causes of Cushing syndrome? In the causes of Cushing syndrome, we have some endogenous causes of Cushing syndrome. Endogenous causes of Cushing syndrome include these are intrinsic to the adrenal gland. So, some of the causes which are endogenous causes of Cushing syndrome are adrenal hyperplasia, where there is adrenal gland is increased. That is, in adrenal hyperplasia, whatever the reason is, there is increased proliferation of adrenal gland, and as a result this can be of two reasons. One, it can be due to the overproduction of pituitary adrenocorticotropic hormone. Whenever there is overproduction or increased production of adrenocorticotropic hormone, this adrenocorticotropic hormone will activate the adrenal glands. Thus the adrenal glands will start producing increased corticosteroids, thus resulting in Cushing syndrome. Second, microadenoma, more commonly than macroadenoma. Adrenal gland can have a microadenoma in its in there might be a microadenoma or macroadenoma in the adrenal gland intrinsically, which produces increased corticosteroids. Second, ectopic adrenocorticotropic hormone production. In ectopic adrenocorticotropic hormone production, there is small cell carcinoma of the lung is seen, is important in ectopic adrenocorticotropic hormone production. Then we have other carcinomas, like we have thymus carcinoid, carcinoma of pancreas, or in bronchial adenoma. So in ectopic ACTH production, we have small ectopic ACTH production, that is ACTH production other than the adrenal gland. That is small cell carcinoma of the lung, thymus carcinoid, or carcinoma of pancreas, or bronchial adenoma. All these can produce ectopic ACTH production. Then there can be sometimes adrenal neoplasias are also associated with Cushing syndrome. That is, in adrenal neoplasias we have adenomas and carcinomas are the adrenal neoplasias which are associated with Cushing syndrome. Because of this adenomas and carcinomas, these will produce increased corticosteroids, thus resulting in Cushing's syndrome. Then we also have some exogenous causes of Cushing syndrome. In exogenous causes of Cushing syndrome, these are there is increased corticosteroid levels are due to the extra these are from outside the body. So these exogenous causes of Cushing syndrome include we have iatrogenic exogenous administration of Cushing syndrome. That is the administration of Cushing syndrome if it is outside the body, like by giving corticosteroids, then it is the exogenous cause of Cushing syndrome. In fact, among all these causes of Cushing syndrome, the most common cause is iatrogenic exogenous administration of corticosteroids resulting in Cushing syndrome is the most common cause.
thank you and thank you for watching.